Good afternoon, everyone. Thank you so much for joining us. My name is Chloe Stracina Dower. I'm going to be one of the moderators for today's event. I really appreciate you all joining us for a virtual discussion of nurses' role in gender-affirming care. We are going to be going through questions for our panelists today. Feel free to add any questions in the chat box as they come up throughout our discussion. And at the end, we will answer questions from the audience. But before we get started, we would like to start off our program with an acknowledgement of Indigenous land. The University of Colorado Anschutz is situated on the traditional territories and ancestral homelands of the Cheyenne and Arapaho nations. This was also the site of trade, hunting, gathering, and healing for many other Native nations, including the Ute, Lakota, Kiowa, Comanche, Apache, Shoshone, and many other Native nations. We acknowledge this land's significance for the Indigenous peoples who lived and continue to live upon it, people whose practices and spiritualities are tied to the land and continue to develop in relationship to the territory and its inhabitants today.
Thank you, Chloe. This event is brought to you by Future Voices, Students for Diversity, Equity, and Inclusion. Future Voices is a student-led organization at the University of Colorado Anschutz College of Nursing. We are committed to fostering a space for students to collectively create a more diverse, equitable, and inclusive nursing community within the college and beyond. Thank you to my event committee members, Hawa Bamba, Omar Macias, Lauren Zanina, and Chloe Stracina Dower for planning this event. My name is Anthony Velasco. I, along with Chloe Stracina Dower, will be your moderators for today's event. Chloe Stracina Dower is a BSN student in the College of Nursing at the University of Colorado Anschutz. Her pronouns are she, her, and hers. Before nursing school, she worked at Planned Parenthood of the Rocky Mountains, providing sexual health care and gender-affirming services at a Denver Health Center. To improve accessibility to care, she led and expanded the center's self-injection training program for transgender and gender-diverse clients using gender-affirming hormone therapy. Chloe currently works on an inpatient psychiatric unit at a local hospital. Seeking to better understand and validate intersections of identity, mental health, and holistic well-being are central values to her developing nursing practice.
Thank you, Anthony. Anthony Velasco, our wonderful event coordinator and co-moderator today, is a PhD student in the College of Nursing at the University of Colorado Anschutz. His pronouns are he, him, his. He currently practices as a senior nurse practitioner at DAP Health, a federally qualified health center in Palm Springs, California. As a co-chair of DAP Health's Gender Wellness Program, he advocates improving access to gender-affirming primary care. He currently serves as an advisory board member for the Center for Health Equity, California State University San Bernardino, and president of the Association of Nurses in AIDS Care, Greater Palm Springs chapter. He is an active member of the World Professional Association for Transgender Health. An ally of the trans community, he provides comprehensive gender-affirming care and advocates for creating better access to safe and gender-affirming spaces for all.
Thank you so much, Chloe. Tell me more. But before we proceed with introductions, we would like to express our deepest gratitude to our panelists. We acknowledge that sharing our personal experiences takes energy, time, and effort, and sometimes this process can be traumatizing. We believe that minoritized people should be compensated when participating in programs like this. And that is why, as a student-led, non-funded student organization, we're so thankful for the generosity of our panelists in participating in today's session. I hope that this will be the first of the many discussions we have on LGBTQ+ issues with more diversity and representation. Finally, we would like to acknowledge our cis privilege. Coming from this position, it is even more important that we approach this discussion with self-reflection, self-evaluation, and cultural humility. Now we are ready to introduce our panelists. We are joined today by a group of experts in gender-affirming care. First, we have Emily L. Graham. Her pronouns are she, her, and hers. She is a faculty of the University of Colorado's College of Nursing's clinic practice site, Sears Sheridan Health Services in the Family Health Clinic. In that role, Emily Gam provides direct care as a behavioral health provider and coordinates master's level trainees as the Behavioral Health Trainee Program Coordinator. Emily is also a licensed clinical social worker, certified addiction counselor too, and approved clinical supervisor. In her role at CUSHS, she also co-founded and co-leads the Culturally and Linguistically Appropriate Services Committee, or CLASS. She also leads clinic education efforts on social justice and culturally responsiveness practice, and fosters community partnership with Transgender Center of the Rockies and Streets Hope. She guest lectures extensively at the College of Nursing and other area universities on culturally responsive practice. Within the community, Emily has served on the Office of Behavioral Health's Cultural Competency Advisory Council, on the Office of Behavioral Health's Office of Behavioral Health's Cultural Competency Advisory Council, and the African American Equality Task Force through the Denver Public Schools. She has presented nationally on workforce development and education, drawing on achievements with the master's level behavioral health training program at CUSHS. We are very excited to have Emily Gam in our panel.
Thank you, Anthony, and I will introduce our next panelist. Next, we have Dr. S Alexander Kemery. His pronouns are he and they. Dr. Kemery is a queer, trans, polyamorous nurse, passionate about LGBTQ+ aging care and trans health. He is an assistant professor of nursing at the University of Indianapolis. His areas of expertise include adult medical surgical nursing, end-of-life care, and LGBT health. He has worked in various nursing specialties, including hematology oncology, medical surgical nursing, post-cardiac catheterization, and progressive care. Prior to becoming faculty at the University of Indianapolis, he worked as a house supervisor for several years. He is currently pursuing licensure as an adult gerontology primary care nurse practitioner. He will be joining us for the first half of our program, and we are delighted to have him on our panel today.
Thank you, Chloe. Next, we have Dr. Joseph P Desantis. His pronouns are he, him, and his. Dr. Desantis is an associate professor at the University of Miami School of Nursing and Health Studies. He is also a research professor at the University of Texas at El Paso School of Nursing. He's the co-director of the mental health course, CHARM, the University of Miami Center for HIV and Research in Mental Health. He is also a community advisory board member of the School of Nursing and Health Study Center for Latino Research Opportunities, or CLARO. Dr. Desantis' research focuses on the intersection of HIV risk and psychosocial mental health issues among various vulnerable populations, including transgender women. He has lectured nationally and internationally on topics related to the care of people with HIV and their families. He's a member of the Association of Nurses in AIDS Care, the American Academy of Nursing, and the American Psychiatric Nurses Association. Thank you, Dr. Desantis, for joining us today.
Next, we have Sable Schultz. Her pronouns are she, her, hers. She is the Director of Transgender Services at the Center on Colfax in Denver. Her work includes inclusivity and awareness trainings, providing resources and support services for the trans community in the Denver metro area, and programming to assist in developing community awareness and engagement. Sable identifies as a queer trans woman and has been engaged in inclusivity and advocacy work for over 15 years. She has worked with the Mental Health Center of Denver, University of Denver's Center for Multicultural Excellence, the Movement Advancement Project, and the LGBTQ Student Resource Center on Auraria campus. We are very excited to have her on our panel.
And finally, we have Ashley Turner. Her pronouns are she, her, and hers. She's a nurse practitioner as well as a PhD student in the College of Nursing at the University of Colorado Anschutz. After earning her undergraduate nursing degree from Georgetown University, she began her nursing career as an ER nurse in New York City. There, she earned her Master's of Science degree, Adult Nurse Practitioner program from New York University. After relocating to Boston, she worked as a nurse practitioner at Boston Healthcare for the Homeless. During this time, she also began working as a provider for the transgender and gender diverse community. Today, she calls Denver home and works as a primary care nurse practitioner at one of Denver Health's FQHCs. She's passionate about working with vulnerable and underserved communities.
And I'd like to give a big thank you again to all of our panelists for joining us today. We're very excited to hear your perspectives on these important topics. So we will go ahead and start off with questions for our panel. To our audience, again, if you have questions, feel free to type them out in the chat section and specify which panelist the question is for. If we're unable to answer all of the questions tonight, feel free to email your question to futurevoices.dei@gmail.com, and we will get you the answer to your question. And we will put that email address again in the chat as we get closer to the end of the discussion. So we will start off with a question for all of our panelists. This first question regards safety and diversity. In a 2015 study of medical students from the US and Canada, a large portion of sexual and gender diverse students avoided disclosing their identities during their program for a variety of reasons, including concerns for safety and discrimination. We want to make our campus and nursing programs safer for sexual and gender diverse students. Can you share with us activities your organizations, faculty members, and students are doing to create safer and welcoming spaces for the LGBTQ+ community, especially gender diverse and transgender people? And I would like to invite Dr. Kemery to start off our discussion today.
Thanks, Chloe. So I will first acknowledge that where I'm at, we're not perfect at this yet, and that it's constantly a work in progress, and that it's taken a lot of years of pushing for even incremental change to get us to where we are. One of the things that I'm most excited about on our campus is that in this upcoming fall semester, we are enrolling our first LGBTQ living learning community, and so we've got a floor set aside just for LGBTQ students and allies, and we're hoping to make that a safe space, because I think working at a institution that is affiliated with a religious entity does make it seem to some of our students that there are no other queer students on campus, even though I've met a lot of them, they just don't know about each other. And so trying to get them all into one space so that they can support one another, take coursework that is specific to LGBTQ content, and just learn how to develop their own identities and how they fit into this community is something I'm really excited about.
Thank you so much, Dr. Kemery, and the rest of our panelists, feel free to chime in and contribute as you'd like.
So our program is more outside of the academic system itself. So the work that we do with the Center on COPAX involves going to organizations, training around LGBTQIA awareness. I know that I've worked with some of the nurses organizations in the Denver, Colorado area. I've done trainings at some healthcare provider centers. I also work closely with organizations like Denver Health's LGBTQ Center of Excellence, and I've been working and coordinating with the University of Denver's Anschutz Transgender Health Centers there. And so a lot of that is that sort of network and engaging and being able to provide insight and information around the needs of my community, and especially in terms of being able to frame topics and questions. So I think that's a lot of the work that I do.
I'd kind of like to echo what Dr. Kemery has talked about. You know, we have made some progress here, you know, at my university, but there's a ways to go, as always, right? Everything can always be improved. I do think we have, you know, living in Miami, which has a large LGBTQ community. I think that, you know, our university is welcoming of these students. We have a number of programs on campus and at the school for our students. We have what we call an ally program where faculty and staff can get training. You know, it's a full day, I think it's a half day or full day workshop on how to meet the needs of LGBTQ students. And all of us who've completed the ally training, we have a little sticker that we put on our door that identifies us as kind of a safe space for students who need those resources. So I'm proud that we do have that. And we also have in our building, which I was ready to fight for this and I was proud that it happened. We have a, and I hope I'm not using the wrong term here, so correct me if I am, but we have gender neutral bathrooms. Is that the correct term? Or is it no gender? I don't know what the correct term is there. But
so one of the, Dr. Santos, I would say gender neutral or all gender.
Okay, perfect. We have that in our School of Nursing, and I'm really happy that we have that. Thank you, Sable, for correcting me.
So at our clinic, this has been a years and years long journey. And as everyone is saying, we're not even close to where we should be, but we've come a really long way. And I'm proud of how far we've come, but also it's a ominous task to think of how far we have to go. What we've been doing is it started with, well, I'll just tell a funny story. Our CEO came to me one day. I'm the only outwardly queer identifying person in the clinic, and she came to me and she said, "Hey, I'm writing a grant. Can you tell me how many LGBTQ individuals there are in our catchment area?" And I was like, "Okay, yeah, let me get on my queer computer and I'll just bust out that number for you." So that's where we were. We've come a long way from that.
We all know each other, right, Emily? Yes.
Right. And so I knew at that point I needed to pick up the ball and start pushing for education within our clinic. And one thing, and I think Dr. Kemery, this is what you're getting at too, is that I would really admonish those of you that are on the call that you have a responsibility to move the ball forward and advocate, even if you're not queer identifying LGBTQ plus. You have more of a responsibility actually, and don't just leave the tasks to the LGBTQ plus folks. But we've been doing a ton of education. Every staff member has to do an LGBTQ 101. It's required as part of your onboarding. We're looking at the clinic from the very first time somebody walks in the door and they're filling out patient paperwork till when they're leaving and they're picking up a prescription from the pharmacy, and how is every point of contact being impacted, and how do we do it in a culturally responsive and affirming way. For our students, the students that we have on site as preceptors, we're really focusing on broaching practices. I don't know how many of you have familiarized yourself with broaching, but we're always talking about how do you broach identity, and we're teaching our folks, and I mean identity globally, not just LGBTQ identity, but we're talking about like how does a medical assistant broach identity in just a few seconds with a patient? How do I broach identity in a therapy session when I start an episode of care? How does a nurse practitioner broach identity when they meet with a patient? All in a way to create a safe, supportive, receptive, and affirming environment. And then I'm lucky enough in part of my capacity with the College of Nursing to sit on the DEI advisory committee. And with that, I really am trying to do anything we can to challenge structural oppression just in a more global way. Getting students like you all involved. I'm telling you, Future Voices puts the rest of us to shame. Like as faculty, like we just don't get it right, but you all get it right most of the time. So it's been really inspiring to see you all. So those are a few things that I've been doing.
If I can also add one thing, all of your input has been very, very insightful. One thing that, it's very important for us to create safe spaces, and we do it in many different ways. And it can be anything, even from wearing, like in a badge, for example, the badge that I'm wearing, I have my pronouns on my badge and a little pin that says, "You are safe with me." Things like that is one of the ways that we can create that safe space, not only for our clients and our patients, but also for our staff who may be identifying as LGBTQ plus and haven't come out yet. That's very, very important. But also for those people who are wearing badges like that, it shouldn't be performative, right? It should be, if you're wearing something like that, and if you have a sticker or a badge or a pin, being an advocate, being an ally, being a part of the community is hard work. And we should be able to not just talk about it, but actually do something about it.
Anthony, I agree with you completely. In my office, we obviously all wear our name badges, and a lot of people wear a lot of different pins on their name badge, but the only thing I wear on mine is the transgender flag. And no one never notices it, anybody who comes in, but then the people who do notice it are the transgender patients, and they recognize it and they point it out. And it's nothing big, it's very small, but I want people to know that, I've done training to be a transgender provider, and that I'm an ally. I try to be an ally of the community, and that they're safe having these discussions with me. And I've had people, patients disclose that they are transgender, that they've never told anybody else, that their primary care provider didn't know, but just because of that little tiny pin that they were able to see, it made them feel comfortable, and like Anthony mentioned, having a safe space. So I think it's so important.
Thank you, everybody, for your input. Now, our next question is also for all of our panelists. This is in regards to clinician education. According to a survey of medical schools across the US and Canada, medical students spend an average of 5 hours only on LGBTQ plus education and training. Similarly, researchers found inadequate LGBTQ plus education and training in other healthcare disciplines, including nursing. What can we do to improve the nursing curriculum to increase competency amongst nurses and other healthcare professionals in providing gender-affirming care? And I'll start off with, maybe you can start off, Ashley.
Thanks so much. Thank you, Anthony. I'll share a little bit about my experience of how I became a transgender provider, and it was my third day as a nurse practitioner. And a nurse just walked down the hallway and was like, "Hey, new nurse practitioner, will you see transgender patients?" And I was a little baffled by the question, because I was like, I see every adult. I didn't understand why I was being asked if I was going to be able to take care of transgender patients. In hindsight, I realized she was asking, like, do you have any training? But I was like, sure, I'd be happy to, assuming that I would get some sort of training. And then they just started popping up on my schedule, and I panicked, basically how I panicked with every new patient that I didn't know what to do. And so I really started reading about it, and I read all the guidelines, and I would basically hunt down any other provider who saw transgender patients and ask them tons of questions. And I went to conferences, and it was really up to me, because within my education as a nurse and then as a nurse practitioner, I did not receive any formal training that I can even recall, especially anything about prescribing hormones or surgery, gender-affirming surgeries. And so I was really an island in myself and searching for anyone who would teach me anything about it. And along the way, I met people, and now being an employee at Denver Health, they have a really wonderful program to support providers who are interested in providing care to this community. And even meetings where we meet regularly and discuss challenging cases and things that we don't have literature behind, because so much of the literature for the LGBTQ plus population, there isn't a lot out there. And so we're always saying, I think this is what we're doing, but I don't really know what the literature says, because there isn't any literature. And so I think it's about advocating for yourself as a provider, and it's a privilege to care for patients, any patient, and it's our responsibility as nurses and providers to educate ourselves. And if we're not being given the education, it's our responsibility to go find it and advocate for it within our institutions.
Thank you so much, Ashley. You're so right. There was this national survey that came out of 27,000 transgender Americans. in 2015, the US Transgender Survey. And one of the things that, transgender and gender diverse people have said is that one of the barriers to care is that they have to teach their providers how to provide gender-affirming care to them. Very, very disappointing, and this is something that we definitely need to improve. I also would like to hear from Emily from the behavioral health perspective in regards to how we can improve the nursing curriculum.
Yeah, thanks, Anthony. And I too, like Ashley, had to, I think schools of social work from which I emerged are more cutting edge than some of the colleges of nursing and schools of medicine. But still, we had a long way to go. And I too started just inundating myself with training. And actually from Denver Health, Liz Kovach and Andrew Miller came out and did some phenomenal trainings for us. And I really encourage that. Like, there are people in the community that have expertise, access it, bring it into wherever you're working as much as you can. And hopefully as future voices, you're not going to be upset with me for this answer, but rather than thinking only about this specific identity as far as education goes, I really think there's some essential foundation building that needs to be done. And I see this at the College of Nursing. We need to be talking about power and privilege and oppression. Those things need to be woven into the entire trajectory of someone's time on campus. There needs to be touch points at different points within their program where you're talking about these things. We need to be implementing assessments like the identity development inventory, and that having those inventories take place, then they can foster conversations amongst students, amongst faculty, amongst staff. Academia is an inherently oppressive system. Let's just be really honest about that. And we have an obligation, if we're going to be about progressing, to turn that on its head. And because if we don't, all we're going to be doing, we can talk about different identities all the time. We can talk about gender expansive folks, but really, if we're not turning the whole system on its head, we're just going to be tokenizing and we're going to be essentializing. And neither one of those things are really getting you where we need to be. The only other thing I'll say is that I really would love the college to operate from a critically conscious pedagogy. Critical consciousness is this element of education that sees professors as big a learner in the education process as the students. It really requires us to change how we envision the classroom, increasing student agency, increasing an acknowledgement and infusing of students' expertise, of their lived experience. Students aren't just these vessels in which professors dump information and then you regurgitate it out, and so that you can graduate. That's the worst paradigm for pedagogy I've ever heard of. So how do we shift the complete pedagogy so we can have these critically conscious conversations? Professors need to take more risks. They need to be vulnerable. There needs to be more humility on behalf of instructors. Okay, I'm going to get on a soapbox here, so I'm just going to be quiet. But I really strongly believe in that complete shift in paradigm.
I totally love, what you mentioned about critical pedagogy. It reminds me of Paulo Freire. Consciente Jao, right? Critical consciousness is very, very important, right? We shouldn't have this banking form of education. Students are not tabula rasa, right? We're not empty vessels. There should be this dialogue between the professor and the students, and that's how we perform learning. And I also want to add that academia is inherently oppressive, so is healthcare, unfortunately. And this is something that we need to, as healthcare clinicians, as a community, need to take care of. Thank you for that insight. I also want to learn from Dr. Kemery what your thoughts regarding this question.
I was jotting down lots of notes because Emily gave me all kinds of things I need to look up and learn more about. I don't know. I don't think we do enough to educate our students. I think it comes with a lot of pitfalls because, at least in my experience, it's all about, in the undergraduate world, it's all about the NCLEX and passing the licensing exam. And that's very frustrating to me because we focus so much on that one test that we miss so many things that are important. And I think that change is going to have to come from much higher up than me. I think it needs, the National Council of State Boards of Nursing need to really look at, does the NCLEX actually do what they think it's supposed to do? Is it telling us whether somebody is really competent to practice, or is it telling us somebody's really good at taking a test? And I think it's more of the latter than the former. But if we are going to require a test as the entry to practice, then how do we make it a test that actually measures whether or not somebody is competent to practice in a way that is responsive to our patients and our community needs? And unfortunately, I think we see a lot of people, in nursing education, nursing students aren't immune to it, to getting into it, because it is it's a profession where you wield a lot of power over people. And I think that attracts sometimes the wrong type of person. And I think we need to be better at screening out those people and figuring out how do we make sure that people are getting into nursing for the right reasons, and that they're not just using it to wield their power over people who are already marginalized.
Thank you, Dr. Kemery. What are your thoughts, Dr. Desantis?
You guys have given such good information. It's kind of hard to follow with that, but I've been a nurse for almost over 30 years, and I would have to say that, Ashley, if you thought you got zero or very little education on this topic, I probably got even less, okay? And I've been lucky that I've been able to encounter situations, much like what Ashley described, that kind of put us into this world, if you will. I kind of became, if you've heard me speak before, I've told this story before, so, bear with me. But how I got interested in this topic was about 20 years ago when I was working as an educator at a large public hospital. The director of nursing showed up in my office one day and said, you work in infection control, you work in HIV care, so I got a problem I need you to help me with. We've had a number of transgender clients who've come into our ER, and they say they're getting substandard care, so can you work on a program for the staff? So you're kind of like, oh, okay, I've got to put this together. And, it was a great learning experience for me because I was able to tap into a community and invite transgender people to come speak at this conference, to give their voices to what was going on. And as I was sitting there, I was like leading this, so to speak. I'm sitting there learning, I'm absorbing from them, what's kind of going on. And that, kind of was like a platform of like, the same that Ashley said, I need to learn more. I need to, expand my research. I need to make sure that I'm researching these type of things. And then I have to be the learner also. When I'm the teacher, I have to be the learner, right? I'm not an expert in this area, okay? I know probably a little bit more about it than some people, but I'm not an expert, and I have to be, I have to learn, and I have to be open to being corrected when I'm wrong, okay? And not because I'm the teacher, I can't get offended, because I've been corrected. So I think that's the thing, the lifelong learning. We have to, as educators, we have to plug that lifelong learning, because I'm learning all the time. My students are learning all the time. We're all learning all the time.
Thank you, Dr. Desantis. And that shows, the importance of cultural humility, how, it's always the process of self-evaluation and self-critiquing for us to be able to be better in what we do and how we provide care for other people. Also, I really like what you said about voices. One of my patients once told me that, transgender people, they have voices. So it's not right for us to say that we are giving them the voice, because they have the voice in the first place. what we need to do is we just need to hand over the mic and amplify their voices. And when we hand over the mic, that mic better have batteries in them, right? So it's really just about amplifying voices, and us as clinicians, as people that work in healthcare, as nurses, we need to be able to amplify the voices of the community and the voices of historically oppressed people. Finally, I also wanted to hear from Sable regarding this regarding this question, especially being a community leader.
Yeah, so there's a few things that come up for me. I want to piggyback off of what Emily said around the need for us to, when we come into either a nursing program or really any sort of academic program, to recognize the cultural biases that we bring in, as well as the cultural biases that have formed our fields, right? There's a lot of that. But at the same time, don't dwell in the guilt around those cultural biases, right? Like honor it, honor that this is where we are coming from, and look towards how we can move past them. So sort of embedding unconscious bias training within programs, things like that, making it a part of those pieces. And also kind of, I know I'm jumping the gun on the chat, but it ties into this a little bit around, because there was a question, how do we ask questions that we're not sure of? And I think recognizing one of the most amazing pieces that I got when I was an undergrad and I was working on our area campus was this article written by Dr. Bohan around the way, especially in the LGBTQ community, the knowledge shift, the idea that all knowledge comes from our elders, had really shifted during the 90s, especially with the rise of the GSAs and things like that. And that now we have a lot of knowledge coming up from our youth and our people living things right now. And I'll tell folks right up, like, terminology changes within the LGBTQ community, especially the trans community, as we deconstruct sort of the colonization that has happened around our genders. And so sometimes it is perfectly appropriate to say, what's the best terminology right now for this, right? What is the best, how are folks referring to this? Just as Dr. Desantis did, right? Like, what's the best way to phrase this? And I think just being honest around, I'm not sure, and putting that out there. And so that goes with the entire field, right? Saying, wow, we are learning things as we go, and the goal is to do the best we can for the moment that we're at now.
Thank you all so much for the great insight from so many different angles that you offered for that question. And I think that you all brought up so many important ways that we can work to acknowledge biases, and then from that open our hearts and our minds up to learning from each other, and how we can, and Emily, I love the importance you mentioned of tackling power and oppression as a fundamental aspect of, our society, but also healthcare. And, you all highlighted ways that we can do that on an individual level, as students, faculty and students on an institutional level, and then all the way up, Dr. Kemery, to like a national, kind of board of nursing level. So that was really great to kind of break down all those different layers. I will introduce our next question, which is on allyship. And again, we invite all of our panelists to share their perspectives on this. Being an ally requires fundamental change and call to action. It requires continuous work in dismantling layers upon layers of structural and social oppression. What does being a trans ally mean to you, and how can someone be a better ally of the trans community? And Sable, I know you just kind of wrapped up our last question, but because of your extensive experience in community advocacy work, I would love to invite you to start off this question, if you're okay with that.
Yeah, that would be great. I think for me, allyship is a lot about advocacy, right? It's about being an accomplice. I've heard in relation to anti-racism work, right? Like the importance of white folks being accomplices to Black and people of color around racism and addressing those. So similarly, cisgender folks being accomplices to trans folks around sort of dismantling the structures of these assumptions about gender, I think is a huge piece of that. Functionally, right, I think pragmatic, the everyday things are sharing pronouns, right? And I recognize even myself, right? There'll be days that I introduce myself and I forget to share my pronouns right away. And so honoring that we are also not perfect people in and of ourselves and just working to do better each time around. But especially things like little things like sharing pronouns, putting that in signatures or having a button or some piece. I mean, that's a functional piece, right? But it's a really super important little step. And it shows that when you do that, like you're demonstrating that you are opening yourself to hear more about who that other person you're meeting and engaging with. That's like one piece, and that's what I would start folks off on.
Thank you for sharing that. And I think these functional pieces are really great, tangible things that we can all take away as students and everyone else who is in the audience today. And I also like that you mentioned the importance of, recognizing that we're not perfect and not expecting ourselves to be perfect, and, handling that with grace. And I would also be, since you had kind of mentioned, Ashley, that, those were some of the steps that you were taking, I'd be curious to hear from you next.
Absolutely. And Sable, I loved what you were saying about being an ally and accompanying people. And I think that it's not solely the responsibility of the transgender community to advocate for themselves. I think it's up for everybody to be advocates for the transgender community. And that's how I see my role within the clinical setting. And, I think I've talked to a lot of providers who don't provide transgender care and just struck up conversations about why not. And the majority comes from, their lack of education and their lack of comfort, and they don't want to mispronounce someone and they don't want to offend anyone. And my goodness, I've gotten it wrong so many times. And I've, called people sir and ma'am. I'm from the Midwest. Like, it's rude if you don't call someone sir and ma'am. And so I've completely changed my practice, and I don't use that with any patient now after mispronouncing a patient. And, you acknowledge it, and I apologize. And I think it's about being willing to make the mistakes that come along with that, and being comfortable being on a journey. And I think it's also about encouraging people around you, like other providers, to take that step to become a transgender provider, and, educating staff. And when people use terminology that could be offensive, politely correcting and say, hey, this is why we say, assigned female at birth, not like genetically a woman or things like that, because that could be offensive. And then starting that conversation and really like actually letting people ask questions. And again, I'm not the expert. I just know a little bit, and I try to share the little bit of knowledge I have just to start the conversation with anyone who's willing to talk about it, because that's how we become an ally, and that's how we advocate for this community.
Thank you for sharing that. And I think that touches on another really important point of the responsibility we all carry to educate others and to call out transphobia and discrimination and oppression of any kind at any level that we experience in our day-to-day lives. Because I know, at least in my experience throughout nursing school, there have been, countless examples of that coming up. And, because of power dynamics among being a student and preceptors, or, the dynamics on the floor, that can, even in that environment, that can be challenging. But I think that is very important, that we all recognize that it's our responsibility to not stay silent when an opportunity to address oppression at any level arises. And Dr. Kemery, I would love to hear what you have to say on this as well.
Well, I liked, I think Anthony, you said earlier, talking about amplifying voices and passing the mic, because I think um, one of the things that rubs me the wrong way, and this is probably not going to be a popular opinion because it never is when I put it on Twitter, is that trans people should be leading trans research and trans people should be leading the national discussion on what trans people need. And it's your job as cis people to make sure that trans people have the support to do that research and to make sure they're making the connections to be published and to have their voices heard, on this national stage and policy is happening. I have, big issues with WPATH as an organization because it's a lot of cis people telling us what trans people should be doing. And it's very kind of frustrating as a trans person to have somebody tell me like what is good for me. When I know what's good for me, and I just need you as a provider to help me facilitate getting access to those things. And I also think it's really important, making sure to speak up when something happens and doing it in the moment, because it's really easy to kind of come behind and be like, hey, that wasn't cool what that person said earlier. I'm really sorry you had to hear that, but that doesn't really do me a lot of good in the moment. I get very tired of being the person who's constantly having to speak up and be like, hey, that's transphobic. Hey, that's homophobic. Because everybody kind of just rolls their eyes at this point because I've been doing it, saying it for so long. So, if you can speak up in that moment and say, like, if somebody says something publicly and they say it in a way that is like very disparaging, and it's not just a simple, honest mistake, speak up and call it out. Because it's really frustrating to get the back end of that and say, have somebody come up to me later and say, hey, sorry, that was not cool. I should have said something. Yeah, you should have said something. So next time, say something. Sorry, that's my soapbox.
I think the speaking up in the moment is a really important skill that we all practice and implement. And especially in healthcare settings, your willingness to speak up in the moment not only creates or, tries to create a safer space immediately for patients and their families, but it also kind of conveys, what the institutional values or the values of the facility that you're at, or whatever type of association you're working in. It affirms those values right away, and that's a really important aspect of safe environments as well. And it kind of disappoints me that it's an unpopular opinion that trans people should be leading trans research. I think that is another really crucial aspect of allyship, is creating opportunities to support communities to be the leaders in research and advocacy. And Professor Gam, I'd love to hear from you next.
Thank you. Well, I'm not a professor, but I appreciate the acknowledgement. I like to dismantle that too. All of these hierarchy and ranking and all that junk. Let's just get rid of that. I'm just Emily. But which isn't a popular opinion, but that's okay. One thing I would say is that I honestly, and this is not necessarily popular opinion either, but there's some nice literature out there about it. I don't get to decide if I'm a trans ally. The trans community gets to decide if I'm a trans ally, based on the work and the advocacy and the way I show up for people who are gender expansive. And so, and I think that cuts across any minoritized status. I just don't think you get to designate yourself as such out of your own privilege. I think crucial is educating myself to be a better ally, educating others. I love Dr. Kemery bringing up the pieces about the advocacy and I think humility, like humility all the time. You can't have enough of it. And to, I think, Sable's points, we're gonna make mistakes, and Ashley's, we're gonna mispronoun. The question is, what do you do when that happens? And you languish in that space and you say, oh my gosh, I'm so sorry, I blew it. I didn't mean to, I'm so sorry, So if you do that, well, one, that's not good allyship because you're making it about you. So what do you do when you make a mistake? Apologize, move on, commit to doing better. There's some great resources, the Practice Pronouns website. If I mispronounce somebody, I get on that website and I require that I have to do like 10 or 15 minutes on that website to reinforce and practice pronoun usage. And I think as a clinic for us, allyship comes in the way in which we show up, not just in an instant or not just in one aspect of somebody's life. I really am pushing our clinic. We need to show up for trans individuals in the full spectrum of their lives. So that means if they're going to come to us for HRT, then we also need to be able to write gender-affirming surgery letters. We can't just say, oh, we're going to, and we are an integrated care clinic, so we do mental health, physical health, dentistry, psych meds. I can't just say, oh yeah, come here for us for this one thing, but then you're going to have to go 10 other places to get the other things that you need. And I know that we have the luxury of providing lots of resources, but even if you maybe can't provide the exact thing, you need to have materials, resources, and things so that people know where they can go to fill in your gap. If there's a gap that you can't fill, you need to have the resources so that people know where they can go to get what they need.
Yeah, thank you, Emily. I think that's a really important point in terms of, because our healthcare system is so fragmented as it is. And when I was working at a clinic providing gender affirming care, that came up all the time, that we, our providers were only licensed to provide a particular area of care, but even just, hormone therapy as part of gender affirming care encompasses so many other aspects: mental health, surgery, all kinds of things, sexual health. And it's important to recognize that it's creating more barriers, that people have to go to other places. And it's your responsibility as a provider to help people navigate this really scattered and challenging healthcare environment. Dr. Desantis, if you'd like to wrap up our discussion on this question, we'd love to hear from you.
Well, with all of these brilliant voices, there's very little left to say. I mean, I think everyone has kind of covered, a little bit of everything. I think, I agree in so many levels and so many points that's been made. I mean, being an ally, it is, we're not the experts. The expert is the person who lives the experience. And so, you have to be, even when you're, like I said, when you're an ally and you probably know a little bit more than the average person, you still have never lived the experience. And so we do have to step down, and we do. And I want to echo what Alex said about, transgender people leading transgender research. Yes. And I want to put another plug in too, that federal agencies need to make more dollars available for this type of research. Okay. And it's very hard. I put out grants, I get very few that I put out. And a lot of the things, even within, sexual gender minority health, very little of those dollars go to nursing. They go to psychology before they go to nursing, so we have to advocate, for more of these dollars to be able to study these things. And if we don't get that, I don't know, there's not going to be much more research if we don't, have the funding to do the work.
Thank you all for the wonderful insights. And one of the things that also resonated with me is, for gender wellness programs, it's very important that these programs are led by trans people for trans people. That's very, very important. And another thing that resonated with me is that we must, for us to become better in allyship, we must be respectfully disruptive of the systems of oppression. I think that's very, very important. And when I talk about systems of oppression, it's not just about at an individual level, but it has to be in all levels, structural levels especially. Our next question is on access to care, particularly on addressing stigma and removing barriers. Numerous studies illustrate how transgender individuals are burdened by social stigma, limiting their access to critical social domains such as healthcare. In fact, according to a survey published by the National Center for Transgender Equality, Approximately 19% have reported being refused care due to their gender identity, while about half of those who receive care reported having to teach their healthcare providers about gender-affirming care. In your experience, what are some of the ways nurses, healthcare providers, and healthcare organizations can do to remove these kinds of barriers? And I'll start off with Dr. Kemery.
I will preface this saying I'll answer this one really quickly. You've probably seen my kids popping in the background now, so I'm going to have to log off after this one to go take care of them. But I think the thing is that you're not going to get the education. One, the education needs to be system-wide. Like, it can't just be the couple of nurses who are cool with trans people educating themselves, on trans needs, because the odds of you getting every trans patient every time somebody walks in is not great. So this needs to be, you need to be advocating for system-wide education. Telling your clinical educators, if you're working in a hospital, or whomever's in charge of, your all the education things that you have to do, that this needs to be a priority, that you need to be bringing in trans folks to do the training, and that everybody has to go. So it can't just be the people who are interested, people who are really passionate about it showing up, because that's not the people who I really worry about, right? I mean, I don't worry about the people who are going to be like, who might get it wrong but do it nicely and apologize for it. I worry about the people who are openly hostile. And so that training needs to be mandatory, and there needs to be a zero tolerance policy for employees who don't treat trans people with respect. At some point it stops being an education gap and it starts being a bigotry issue. And so I think that that's going to require, a joint effort from your education department and from your management to both have that training, require people to go to it, and to hold people accountable when they continue to be malicious. That is all I will say. I will drop my contact info in the chat, though, if anybody does have follow-up questions. I really appreciate y'all having me. And hope you guys have a great rest of your panel.
Thank you, Dr. Kemery.
Thank you so much, Dr. Kemery.
I would love to hear what your thoughts regarding this, Dr. Desantis.
Oh, I love to talk about this, and I do have to put in a little plug here for some of the work that we've done and that I've done that has included your dean, Elias Provencio Vasquez. We published an article last year on healthcare experiences, a satisfaction in healthcare experiences among transgender women. And that came out last year in Perspectives of Psychiatric Care. And if you're interested, I'll send you the link. All of the things that you guys talked about, or that you all talked about, sorry, I didn't mean to say you guys, but I use that term all the time, but that we all talked about of transgender people having to teach their providers. That's a big issue. And then, as Alex said earlier, there's a wide spectrum of people, just being not informed to being openly hostile to trans folks. And there's a lot of opportunity there. I never turned down an opportunity to talk to any level of nursing student, master's, BSN, whatever, about transgender care. I have, a little dog and pony show on that. And again, I don't really consider myself an expert on it, but I do kind of know a little bit more than the average person. And I'm willing to share what I've learned and share the experiences of the voices of the people that I've talked to, that I've encountered. And I think if you can always, I don't, it kind of ties back to what we said before. When you speak about trans issues, you have to be careful that you don't speak for people, right? Okay, being an ally doesn't allow you to speak for people. It allows you to speak about. And I think that we have to keep that in mind in both education and in healthcare. Okay, because again, if we don't live it, we don't experience it the same way as the people who live it.
Thank you, Dr. Desantis. And yes, that's actually how I found Dr. Desantis. Well, I met Dr. Desantis like 2 years ago at the ANAC conference in Portland. But I cited his paper like last semester and had this kind of like circle moment. And that's how we were able to have Dr. Desantis in our panel today. I also want to hear your thoughts on this, Dable.
I think a lot of it, oh, somebody's got a puppy, I think. I think a lot of it, again, to echo what has been said, the importance of having unconscious bias training in your organizations and actively requesting that sort of training happen in your organizations, or checking in, like, you know, that as part of the orientation process. I feel like so much of our world, and I think the last year has really accented this, right? So much of our world is boom, hop in, boom, get the job, you're on the floor, boom, 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 boom. And we forget that we need to be better oriented in our organizations, and we need to make sure our community members in our organizations are aware of the values that we want to impart in our organizations. And I think that we need to make sure that we get back to having orientation, essentially. This is, and talking about, this is how we collect SOGI data. This is how we, so sexual orientation, gender identity data. This is the importance. This is why we do these things, right, on all levels. And basically re-embedding that as part of that orientation process, I think, is really critical.
Thank you so much, Dable. Yeah, SOGI information, that's like one of the most basic things that we can do and has to be done. I believe it's required to have SOGI data, especially for, for healthcare. Emily, I'm curious to see what your thoughts regarding this question as well.
Yeah, thank you. I mean, I say, well, thanks for bringing up the SOGI piece. We've been fighting that battle for a long time. You know, you have an electronic health record that does one thing and asks, you know, has certain categories, and you have new patient paperwork that has other categories, and then you have grant reporting expectations that have different categories. And cisgender people need to get real creative on how to make those things talk to each other and work in a responsive way. And that's something I've been challenging our organization to do. And you're right, it goes, you know, throughout every part of the organization. Another thing I would say is, you know, this may be harsh or reductionistic, but if we want there to be better access, reduce barriers, address stigma, we need to, in our hiring practices, have as part of minimum qualifications, people having to demonstrate their competency in these areas. I mean, if you're bringing people into clinics and you're hiring people that don't know how to do this work, then you're not going to decrease stigma. Every hiring committee that I am on, it's in preferred qualifications for somebody to have to demonstrate these competencies, and we just can't keep doing that. It's got to be moved and prioritized in a higher way. So hiring, I think figuring out better avenues for hiring. And I appreciate folks talking about things being mandatory and being required. You know, your organization has to, you don't get a choice whether you attend these events. And then secondly, one of the biggest challenges we've faced as a clinic is, and I think folks don't recognize it as much as the importance of intersectionality. You know, we don't show up in this space with one identity. You know, I'm not just queer, I'm not just cisgender. And that's been a challenge for us. We serve a highly minoritized racial and ethnic population. The majority of our clinic staff, or I would say at least half of our clinic staff, have minoritized racial and ethnic identities. And there's just differences in culture. And so you're not, we're fighting a battle and facing a challenge where we're not only just educating people, but we're having to meet them in other parts of their identity. And they're struggling in a way to have conversations about sexual orientation and gender identity because of the stigma in a different identity. And so really, I think not underestimating the importance of intersectionality and how that impacts.
Thank you so much, Emily. Yeah, and I'm so glad that you brought up intersectionality. It reminds me of Patricia Hill Collins, who talked about intersectionality a lot. And one of the things that she talked about was that, all of us have levels of oppression and domination, right? Me as a cis person, me as a person of color is a historically oppressed community member, but also also at the same time, I'm a cis male, and that comes with privileges. So all this layers of identities is very, very important for us to acknowledge and understand all these privileges that comes along with these identities. Finally, I'll go ahead and have Ashley finish off our conversation in this question.
Yeah, I mean, I think the short answer for me is we need to do better. And I think that's echoing a lot of what everyone said. And I agree that having this be kind of a foundational piece of education, and whether that's nursing education or, behavioral health or medicine or for MA students, just it comes from every single person who's going to impact a patient's care. And I think it should be a foundational piece that we learn throughout our education, and then continue it once we get to the organizational level. And it should be something where people are required to go. It's not just the people who are passionate and excited about it. I definitely agree with that point. And I think when we really work on changing the culture of our organizations and our academic institutions to make this an inclusive part, and sometimes that requires getting comfortable being uncomfortable. And I think that's a good thing. Like, being uncomfortable is a good thing, and it may not be something we're familiar with, but we need to do better as academic organizations and as healthcare organizations, and as individuals. And if we challenge ourselves to become more educated about this, then we can help other people and have those conversations so that it's not so difficult when we encounter these situations in our academic or professional settings.
Thank you all for your answers to that topic. And it's can be such a challenging issue to even think about, addressing these overwhelming barriers to care. But you all brought up a lot of really tangible ways that we can, in our lives as individuals and as part of organizations, as nurses, how we can work to address some of those barriers. And kind of tying into barriers to care, our next question highlights issues of health equity, in particular health disparities. Trans people face disparities in care, several. For example, according to the US Transgender Survey, 40% of trans people have attempted suicide in their lifetime. And that's 9 times the rate of the US population. And that is working in a psychiatric environment, that is substantial, 40%. According to the CDC, the number of trans people who receive a new HIV diagnosis in 2017 was 3 times higher than the national average. And these are only some of the many, many health disparities trans people face. What are some of the things we can do to address these health disparities? And Dr. Desantis, I would like to invite you to start off this discussion.
Oh my gosh, this is the most difficult question ever. I mean, it's like, I always joke with students about this. Like, if I knew the answer to this question, I could have my own sit-down interview with Oprah, and be like, have my own little 15 minutes of fame there. I mean, there's so many, healthcare disparities amongst, among trans people. I mean, you mentioned, mental health. You mentioned HIV, but we also have to look at, you know, substance use is also very high. And then, you know, other things that are related we have to look at also. We have to look at some of these things like, you know, stable housing, stable employment. All of these things impact these health disparities. So, you know, I think if I could say what's the root of all of these issues, I think it's, you know, compared to the general population, transgender people often don't have those basic necessities of life that I mentioned, like housing and employment and, you know, safety and a violence-free environment and those type of things. And I think those are kind of really the roots of all of these healthcare disparities. You know, for example, we talk about HIV care. You know, if you don't have stable, you know, economics and you don't have stable housing, if you're a trans woman, that might force you to have to do sex work, which increases your risk for HIV infection. Okay, and it also increases your risk for violence. So all of these, you know, basic things, I think, are the root of the health disparities. So I think one of the things that we have to do if we want to address these health disparities is making sure people have stable housing, making sure people have jobs, making sure people live in or live in, you know, violence-free environments. That's the start. I don't know if that's the, you know, but I think it would be a good start.
Yeah, I think that's a really important point that you bring up, you know, these basic necessities of life. And, you know, even on a day-to-day nursing basis, you know, that could just start with asking people, what is your living situation like? Or what is your financial situation like? And sometimes when I was working at Planned Parenthood, questions like that would bring up, you know, all of these issues. And it's like, well, that's why it's been hard for you to make it to your appointment. That's why you've, you know, not been able to fill your prescriptions. And asking those questions can then help you connect people to resources, and knowing those resources can make a tremendous difference. So thank you for bringing that up. Emily, I'd like to hear from you next, if you don't mind.
Yeah, thank you. Well, Dr. Desantis, you're preaching to the choir with me on talking about social determinants of health. Thank you for bringing that up. That's so crucial. I want to feed off of that piece, but just for a second, I think I'm going to go back again, broken record, to the fact that if we're not looking at overarching systems of discrimination, oppression, talking about power and privilege, you know, this stuff, health disparities are just a byproduct of those systems. And so really getting at the core, to me, is essential. But to feed off of what Dr. Desantis just said, you know, social determinants of health are 40% responsible for the health outcomes of an individual. That's a lot. That's a whole lot. Absolutely. If we don't understand what patients are dealing with, housing and discrimination and food and, you know, ability to walk around their neighborhood, you know, are there sidewalks in their neighborhood that they can walk on? You know, it's all of those things. That's 40% determinant. Your health outcomes are 40% determinant. And how much time really clinically do we spend? How many resources do we have and devote to social determinants? Very little. In education, how much in your classes is social determinants focused on and talked about? I would imagine not very much. And then I'm going to do a little plug for mental health folks. But the next largest percentage of what's determinant of health outcomes is health behaviors. The work that I do, the mental health, we're 30% determinant of health outcomes. And I make about $30,000 a year less than a nurse practitioner. That's just the priorities. That's what we focus on. And if you look at the pie chart, I can provide it if anybody wants me to, but clinical intervention is only 10% determinant of somebody's health outcomes. But yet, look at where the money is spent, look at where the time is spent, look at where education dollars are spent. And I know I'm kind of getting on a tangent, but truly, if we want to talk about health disparities, we got to shift our priorities and be putting time and money into things that we know statistically will help the outcome, will better help the outcomes of individuals, including gender expansive folks.
Thank you so much, Emily. And that was the first time I've heard that statistic about social determinants of health and health behaviors being together 70% of health outcomes. I mean, that's just astonishing. And speaking from my own experience through my education, I would echo that that has not been proportionately, represented in our discussion of health conditions, health in general. So I think that's a really important aspect of how can we incorporate discussion about health behaviors, mental health, and social determinants of health on a foundational level throughout our nursing curriculum. Ashley, with your experience providing transgender health, especially at Denver Health, which as an organization addresses health disparities from a fundamental basis, I'd love to hear from you next.
Yeah, so many things came to mind reading this question and then hearing everyone's perspectives on it. And I think that statistic of the 40% of trans people have attempted suicide, that's something that really cuts me to the core. And I think about often when I'm treating my patients, and a lot of the gender-affirming hormone therapy that we prescribe, in some, if not many patients, it can be harm reduction and suicide prevention. And we always have to keep that in mind, because there are pros and cons to everything. But when we're treating patients, we have to hear what they're saying and how important those medications and treatments are in their life. And sometimes that needs to supersede the risk. Obviously, with very extensive conversations about the risks and making sure that they're in a place where they can understand them. But we also have to understand, as providers and people providing care, whatever level that is, that we need to hear their voice, and we need to really not understand that, but hear that and take that into consideration when we're prescribing medications. I also feel that having access to primary and preventative care is so important, because not only are these folks transgender people, but they are also people who have cancer risks, and cancer risks that are often adjusted by some of the hormones that they're on. And we cannot ignore the other parts of their health and their lives and just treat them as, you're a transgender patient, because there's so much more that needs to be cared for and prevented through that. Gosh, Emily, the behavioral health piece, I agree with that so firmly. Sometimes I'm like, my job is so small, and what we really need is more behavioral health, because I can tell a patient or prescribe a medication, encourage them to do something all day till I'm blue in the face. But if they're struggling with, mental health or social determinants of health issues, like they don't have access, they don't have a refrigerator to put insulin, their depression isn't well controlled or being addressed, it's not going to do anything if we don't address the underlying things that are contributing to their the way they're using their healthcare or not. And so I agree so firmly with you, Emily, that integrating behavioral health, if not that being the defining thing within their treatment, is so important. And I feel very privileged that at Denver Health we work very closely with our mental health providers and consult regularly, and we really take that into consideration, and sometimes they're driving the ship with this. So I agree with what you said.
Thank you so much, Ashley. And I appreciate what you said about risk versus benefit. And I think sometimes we, as health professionals, kind of hold that position of power of where we are the ones that know the best risk versus benefit. And I think that's a really important point, to hear what our patients are saying and what does the risk benefit mean to them, and how can we respect that and honor that. And Sable, I'm sure that you, with your community work, see these health disparities and the impact of this every single day. So I would love to have you wrap up our discussion on this topic.
Yeah, so the sassy leftist in me wants to declare the #1 source of health disparities is capitalism. But I don't think that they would actually let me on Oprah to talk 15 minutes about that. So I think so much of our health is tied up to economic inequity, right? And there is such a deep intersection around the experiences that we have in economic access, and not just in terms of like what my annual income is, but also in terms of the economic impact of time and being able to divide and focus on so many things, right? Like as a trans person, not only do I have to navigate the world, navigate the trans experience of the world, I then have to navigate like, what is my treatment going to cost me? I have no clue half the time. So like, if there can be a system in place to be very upfront and transparent about that. But the problem is, right, like, what is the insurance going to cover? So there's a big mystery with that. And then suddenly surprise bill, and I'm like, I don't want to deal with this. I don't want to deal with it. I've been dealing with so many other things. And so we really need to build within structures, right, the people that can help folks who are struggling with navigating the time and attention and the money to support their healthcare needs as well. Like we need more patient navigators, and we need to empower them with the ability to check with billing, and then the check with nursing, and then the check with the doctors, and we need more of them, right? And to be able to sort of almost case manage each of our people navigating through the system. And you'll find like some folks are like, yeah, I'm fine, I'm good, right? But others will really super appreciate that little extra connection with somebody who's there like, hey, how is this going on? What's been the impact? Like that sort of check-in piece. So really, short of a massive transformation around the way wealth and power is redistributed in our society, I think having to build the structures within there to go, what are the deeper questions that folks need assistance with? And maybe recognizing both that mix of trauma and pride each of our people come in with, right? Like it's very scary to talk about economic impacts and how it may limit an individual, like how it might limit me on pursuing that, right? Like, so all of those pieces in recognizing that every single person has that when they come into our space, I think is a huge step towards addressing some of those pieces.
Thank you all. I'm so inspired. I'm just like, keep on snapping my fingers here. I'm like, yes, I totally agree with all of what you all are saying. And, two thoughts come to mind, when I think about health, right? Health is not just about taking medication. It's not about just a pill that you swallow. It's also about making sure that you have reliable transportation, being able to make sure that you have a roof over your head, having nutritious food, access to those kind of things. That's health. It's not just about medicine. Health is everything. And then another point that I wanted to make too is that, I still see, unfortunately, on textbooks, gender identity or sexual orientation or race or ethnicity being listed as risk factors for certain conditions. Gender identity, sexual orientation, race and ethnicity are not the risk factors, for example, for HIV. I think, it's social and structural determinants of health, along with structural racism and stigma. Those are the things that places people at risk for certain conditions. Yep, so our next question is also for all of our panelists. This is in regards to transition. In a 2018 study, 14% of trans women and 72% of trans men said they don't ever want gender-affirming surgery. Can you share with us how, other than surgery, can clinicians be able to support their transgender and gender diverse patients in affirming their gender identity? And more importantly, how can nurses be involved in this process? I'll start it off with Ashley.
Thank Thank you. Yeah, I mean, I think there's multiple different ways for people who aren't interested in surgery. I would say a lot of the patients that I've worked with aren't necessarily at this moment interested in surgery or even ever. And I think the gender affirming hormone therapy is a lot of what people are interested in. And even people who aren't, I think just being able to have those conversations about what life is like for them and what is important to them, because I may have what I think are my goals of what they would want, but those mean nothing. And so it's having those conversations of what are your goals, and how can I assist you, and what do you need from me? And I think coming from a provider perspective or a nurse perspective, that feels a little awkward to ask, because we're used to saying, I know what you need, I know what you want, and this is what you need to get there. But that's not really our role as clinicians in general, but especially within this population, because I have no idea what's important to them. And so I think really listening, and then once they do tell us, advocating for whatever that may be. If it's just that they need help banding, or they need to know different things of what they can do and what would be healthy and what would be harmful, or what their cancer screening guidelines are because of this, and how their gender identity changes it, and how hormone therapy would change that. Just really going through all of that information. And when I inevitably don't know the answer, finding the answer, putting in the work to do the research, ask other providers, call Anthony and ask him what I should do, because he has more experience than I do. And really going to the other people in the community and doing that research and helping with some of those barriers, like Sable was saying, that get in the way of care. How can we as professional nurses, break down some of those barriers and alleviate some of that stress? And I think that's how we can care for these folks more deeply.
Thank you so much, Ashley. I wanted to echo what you're saying. Transition journey is different for everybody. Some people, they're not interested in hormones or any gender affirming medical intervention or any surgical interventions. Just affirming their gender identity is enough. And it's very important for us as clinicians, as nurses, as healthcare professionals to be able to affirm that gender, wherever they are in their gender journey. I also wanted to hear from Sable regarding this topic.
Yeah, I think one of the number one things is recognizing that each person is on their own journey in relation to gender. I think it's really important that even cisgender people, their relationship with their bodies and their genders change over time, right? I'm sure anybody that has worked with menopausal cisgender women and postmenopausal cisgender women have had to have conversations around what is your life like now? How do you relate to your identity in these ways? And many of them have to process new relationships with how they relate to their lives. So I think recognizing that. And so likewise, right, there is no one single set of medical procedures that all transgender and gender diverse folks are going to pursue. I think thinking about asking questions outside of transition related care is really important. Asking about things like, what is your long-term plans? Asking things like, what is your desire for family planning, right? In part of that, because that can help inform what transition related care a person may be seeking, right? So all of those pieces I think is super critical, right? So recognizing that trans folks are holistic people, and our trans identity, while a really critical and super important part of who we are, is just one piece of our entire healthcare matrix, I think is a lot of it, and recognizing that.
Thank you so much, Sable. What are your thoughts regarding this, Dr. Desantis?
This is an easy question. You guys always give me the hard questions and make me answer them first. But I think this is a really easy one because, the patient knows what is best. Okay. And if the patient says, I don't want hormones, I don't want surgery, you know, I'm fine, this is what I want, I'm good, then we have to listen to that and to support that. You know, we do this, well, sometimes we do this in healthcare. You know, we always, you know, say that the patient knows best, right? The client knows best. And I think this is one of these examples where the person knows what is best for them. And, you know, if they decide that, you know, hormones aren't right or surgery isn't right, then we have to support that. And, you know, it's important that we try not to put, you know, like Ashley mentioned, try not to put our own, you know, biases or our own, you know, I think you should do this, because, you know, I will tell you, the general population thinks that all transgender people want surgery and hormones. Okay, they really like think that this is like the ultimate goal. And when, you know, and when we talk about this, they're very surprised to hear this. And so, you know, given that this occurs, we should support it. And I want to say thanks to Emily, because Emily, when I was struggling to figure out the word social determinants of health, you came in and saved me there. I could not think of that word for anything. So thank you.
Thank you, Dr. Desantis. And Emily, if you could wrap up this topic for us, please.
Sure, yeah. Yeah, so what we do at the clinic, just if we were going to talk about this in a really pragmatic way, is that I have a shared drive and a binder that includes resources for packing and binding, where people can get those things for free or at a discounted rate because it's all really expensive. I can walk people through getting to the Colorado name change project and being able to change your name if you would like. If you want to change your marker on your driver's license in Colorado, you can do that now, and I have avenues to help people with that. So yeah, I love that we're talking about transitioning in a very broad way. I appreciate that. I think, and I think, Sable, you were kind of getting at it, the importance of the journey. We have to show and demonstrate a commitment that we're with these folks for their journey. And that journey changes and evolves with time. I had an amazing trans woman tell me one time, she likens it to going to a store and trying on different clothes. Like you go in and you try them on, and sometimes the clothes, when you try them on, they look right and they feel like you. Sometimes you try them on and they're not quite right. Sometimes it's a fashion style that you wear for a while and then it's not really you anymore and it changes. And so how do we demonstrate to patients that we're on this journey with them? We're on it with them wherever they are at any given time. And that means we have to check in with folks and not just assume that if when I saw them 2 months ago, they're in the same place they are today. And I know there's a future question here about youth. Youth are exceptionally fluid and always changing and evolving. And yeah, if I see a youth 1 week and I see the same person the next week, I never assume that they're going to be in the same place as far as their identity goes. And so it's important to ask and just meet folks, like Dr. Desantis said, meet people where they are.
Thank you so much, Emily, and you helped facilitate this transition nicely to the next question. But before we go into that, I'd just like to echo what you were all saying. And this, you know, some of these points get back to like Nursing School 101 and asking open-ended questions. And I remember in nursing school when we were talking about effective communication, you know, being like, oh, whatever, I know how to talk to people, you know, I don't know why we're spending so much time on this. But then going into practice, it is really challenging sometimes to frame questions in an open-ended way and to not ask them in a yes or no way, and to really analyze what assumptions you have about people before you even start talking about them or start talking to them. So I think, you know, really challenging ourselves to ask open-ended questions and minimize our assumptions about people, and just the, you know, basic aspect of seeing all of our patients, including our gender diverse and transgender patients, as multi-dimensional people with holistic needs who are continually evolving over time. And now we'll kind of dive into the question about youth and young adults that Emily foreshadowed. A national survey by the Gay, Lesbian, and Straight Education Network has found that 75% of trans youth feel unsafe at school. It is not just hostility from peers that threatens equal opportunity for trans and gender diverse students. Too often, the structural barriers placed, such as refusing to respect the student's gender identity and denying access to restrooms consistent with their gender identity, are additional stressors youth face in the academic setting. Can you share with us your experience working with youth and young adults and how we can address this issue? And Sable, I'd like to invite you to start us off on this one.
Ooh. Addressing youth needs as adults, I think really a lot of it comes down to creating spaces where youth can really express themselves, but also have empowerment around making those spaces. The Center on Colfax has a program called Rainbow Alley, which serves youth ages 11 to 21, and does things like go out to schools and do programming and discussions around that. But I think one of the super critical pieces that Rainbow Alley did to really reinvent and revitalize itself was actively connecting with youth and empowering them with helping shape the programming at Rainbow Alley. So to sort of port that into larger healthcare network, making sure that your youth-oriented programs connect with the youth of those programs and work with them to provide feedback to the program, right? Empower them, make them a part of your steering committees in a way, right? Like make them a voice within the structures themselves. And I think that will do an amazing thing, because not only do you get to hear what youth are talking about and get to hear like sort of the cutting edge theory around gender and idea, but it also empowers them with a sense of having some control over their lives, right? And having control over the situations that they're in, and hopefully helps cultivate their own leadership and provide sort of a mentorship for them. So that's kind of like my big picture on that.
Thank you so much, Sable. And I think mentorship and empowering youth can really help them lead the way on this education and creating safer spaces. Emily, I'd love to hear from you next.
Yeah, thanks, Sable. You just kind of took the words out of my mouth. First, I have to say Rainbow Alley is just one of the most amazing places in the entire universe. And yeah, so yeah, kudos to you and your organization for that. Oh, and everybody, Sable sends out an amazing transgender resource email. I don't know how often you send it, but anyway, I want to plug that too, because I utilize those all the time in my work with clients. So thank you for that. But for you specifically, I couldn't agree more. Any person who is minoritized, marginalized, they are experiencing trauma on a daily basis. And if you can give, one way to heal trauma is to give power, control, choice. So, so then youth are they're doubly traumatized because they're youth. So they have no power or control really in their lives in many ways. So absolutely, Sable, I agree 100%. If we can give youth power, choice, control, make them the experts, you know, they are the experts of their own lives. When I'm with youth, I feel like I'm 150 years old, and I name that, and I make fun of myself, and I try to be really vulnerable and kind of like an idiot so they can make fun of me, but yet we can kind of connect in me being an idiot. Yeah, and then I just have to, it's like I said, it's always evolving, so I'm always educating myself on how to best show up for youth.
Thank you, Emily. And I think it's really important to recognize the impact of trauma in all of our patients, and particularly with youth. And coming from a mental health background, you really see the way trauma plays out, not only in mental health, but in all of the physical sequelae as well. And I think modeling vulnerability, working with youth, is a really important way to foster connection and create a safe environment. So thank you. Ashley, if you would like to go next.
Sure. So I am an adult nurse practitioner, so I don't treat the transgender youth at all. But I can bring a different perspective in that I'm a mom, and I have 5-year-old twin girls. And I think, you know, this allyship and this encouragement of bringing in these conversations really starts at all levels, like in education organizations, but also just in your general life and in public, being an advocate for this community. And so I talk to my girls about it, and we talk about different family structures, that some people have 2 mommies, some people have 2 daddies, some people have 1 of each. We talk about transgender identities and gender identity, and how, you know, you don't always have to wear a dress and you don't have to like the color pink. And I think it's really important, and I've valued this in being a mom, of really instilling that lack of a barrier and those lack of categories from a young age. And so I think that's another way in which that we can advocate for these communities, is by starting it young and using in all parts of our life, not just in our professional and educational lives.
Thank you so much, Ashley, for sharing your perspective as a parent. And I think that brings up really important points of how we can foster diversity and inclusivity, you know, within our daily lives, with our families, with our friend circles, and how that can create a totally different experience for children growing up in those environments. And Dr. Desantis, I'll have you close us out on this one.
Again, you always give me the easy ones when I'm last, okay? I am a pediatric nurse practitioner, and I'm a clinical specialist in child and adolescent psych nursing. And so this, I think, is one of the easiest questions to answer, because youth are the most vulnerable, okay? They are the most vulnerable. And, you know, Emily, I have to piggyback on what you said about trauma. You know, we know that transgender and sexual gender minority people experience a lot of trauma in childhood. And, you know, these youth are closer in age to this trauma than adults. And I'm not saying that it's any better or it's any worse, but we have to remember the impact of that trauma, that adverse childhood experiences, that these things have on their vulnerable development. And, you know, if you really want to reach, you know, and make an impact, youth is the way to, you know, that youth group is the way to make the impact. They are the most vulnerable, but they're the most impressionable too. And you know, working with them and you know, helping them and providing them with the services that they need, you have a really big impact. You don't realize sometimes as a healthcare provider the big impact that you have on these. You know, I've seen these kids when they've grown up, you know, when they've become adults, and, you know, I would be somewhere and they would come up to me and, you don't remember me, do you? And I would like, well, you kind of look kind of familiar, and but they remember, you know, what you did for them. And, you know, that it goes back to that saying, you know, you'll never remember what somebody says to you, but you'll remember how they made you feel when they said that to you. And I think that's an important thing that we have to keep in mind when we're working with youth. They're challenging. They are very challenging to work with, but also very rewarding.
Thank you. Thank you all for the great insights. You know, one of the things that we need to acknowledge is that, you know, even though they have not been in this world for very long, they bring a lot of world experiences already. They have knowledge and they have these experiences that, you know, I've always learned a lot from my younger patients and from nursing students, from other folks, from my colleagues, always learning from them. So we need to acknowledge that. So I'm going to close out our presentation. I'm going to combine our last two questions into one. According to the National Gay and Lesbian Task Force, even though more than 80% of trans people reported access to care, 28% reported postponing necessary medical care, and 33% reported delaying preventative care due to discrimination by healthcare providers. What would you say to the trans, non-binary, and gender diverse people somewhere watching our virtual presentation today, which will be posted in our social media platforms, by the way, who is afraid to receive care due to fear of discrimination? Additionally, what would you say to the nurses and other healthcare professionals watching today? And I'll start off with Emily.
All right, this is a big question. Thanks, Anthony. I'm tired and worn down, and now you're gonna load me with it. No, it's all good. I mean, I think the first part of the question, speaking to gender diverse individuals, I think I can't move forward on that question or that answer without saying sincerely apologizing for my privilege, my place of privilege as a white cisgender individual. We have failed gender expansive individuals, failed them in a significant way. And that I hope us being here today and having this conversation can create some sort of hope and some sort of ability for gender expansive folks to expect better, because they deserve better. They deserve better than what we're doing right now. And to know that good places do exist. You know, I think we all acknowledged here as we started that, you know, and I'll say for me in my clinic, we do a lot of things really well. We do a lot of things not so well. But I do believe people that come here, their basic humanity as a person is acknowledged and honored. And you know, places like that do exist. And I also think it's important to harness the power of community. You know, I have told our people, I said, you know, if we mess this up, if we don't do, you know, we have this partnership with Transgender of the Center of the Rockies. If we do this wrong, this community is it'll spread like wildfire. You know, the whole community will know that we've not done this well. And so know the power of community, know the power of when you do it well, that there is a ripple effect, so that other people experience that. The word travels, and that just, for me, challenges me to keep the bar high and try to keep reaching that high bar so as not to disappoint people. I think for nurses and other professionals, I can't overstate enough, educate yourself. Know your limitations. Be willing to refer somebody out if you can't provide the care in an ethical and culturally responsive way. You need to help them find another place to go. You have a moral, I mean, do no harm as our basic edict. And if you can't provide responsive care, then you're doing harm. And it's important to refer out. Again, apologizing if you make a mistake, but then moving on, you know, not wallowing in it, examining your privilege consistently. When you're looking for a job, be asking them about their policies and procedures around treatment of LGBTQ plus individuals. Like, what do they do? I don't want to be hired at an organization that doesn't have a way to examine their electronic health record and you know, have people's pronouns in there. I encourage you to be asking questions in job interviews about how they do that work. Yeah, and then lastly, I think advocacy and as I said at the outset, you know, not relying on people in their minoritized status to do all the advocacy, but stepping in and doing it yourself.
Thank you so much, Emily. Ashley, what would you say to somebody, a transgender or gender diverse person watching today? And what would you also say to nurses and other healthcare professionals watching today?
Yeah, I mean, I first want to acknowledge the trauma that I know a lot of patients in this community have gone through, similarly to Emily, because I've heard the stories from my patients and at conferences and seen it in action. And it's horrible, and we need to do better again. And I think we have a long way to go. And similar to what Emily said, you know, there are places out there where we are trying. And again, trying is not enough, but that may be where we are at the moment. And I think, you know, really acknowledging our bias that we have as nurses, and going into situations, you know, naming it, like Emily had mentioned in the past that she's done with adolescents, like naming the bias that we carry with us, and carrying that into our clinical situations. And again, going back to the piece of, it's not, the education is not always going to be handed to you. So as a nurse, it's your responsibility to read the articles, read the guidelines, educate yourself, and then also advocate for that education within your institution. If this is not a topic of conversation that's coming up, bring it up, ask for more education, ask for lectures, ask for guest speakers on it. I mean, I can't tell you how many times Anthony and I have been in a conversation in one of our classes, and we bring up, well, how do we look at this from the transgender perspective? How do we look at this from the gender diverse perspective? Because those conversations are so important, and it's not always going to be spoon fed to you. You have to go out there and fight for it. And this is how it starts.
Thank you, Ashley. We have to be respectfully disruptive of oppressive systems. I can't emphasize that more enough. Dr. Desantis, what would you say to somebody watching today who is transgender or gender diverse? And what would you say to nurses and other healthcare professionals watching today?
Okay, to the clients, I would say, when you go to healthcare, demand care. All right, make sure that you, you know, speak up. Make sure that your needs get met. And I know that's really hard. I know that's really hard sometimes for people who, you know, are marginalized or feel marginalized. But when you go into healthcare, you're the consumer, right? And we believe that the consumer is always right, right? The client's always right. So when somebody comes into healthcare, they need to demand that they get care. Healthcare is a right, and they have the right to that type of healthcare. And I would also say to transgender people, if you're not getting the healthcare that you need, okay, and you do have an option to go somewhere else, go somewhere else. Go somewhere if you have that option. Again, it's sometimes hard, but if your needs aren't being met, go where your needs are being met. Okay. And to nurses, I would say the same thing that everyone's already said: educate yourself, update yourself, be open, be welcoming. The first thing that people want to see when they walk into a healthcare facility is that the people appear welcoming. A smile, a hello, an acknowledgement. That's the start of building a relationship, right? And we want to build relationships with these clients. So that's the start of doing it. And again, this is kind of one of those really global questions, like, it's like the Miss Universe question. What do you want? World peace, right? But how do you achieve that? It's a little hard. Healthcare is lagging behind. We're behind. We're trying to catch up and do better at this. So, demand what you need for both nurses and for clients.
Thank you so much, Dr. Desantis. And finally, I would love to hear your thoughts about this, Sable.
Yeah, so for transgender community members, again, echoing the advocate for yourself, push for it, but also document, right, what your experiences have been, and don't be afraid to file a civil rights complaint if it comes down to it. For nurses coming into the program, remember, as nurses, I think more than almost anybody else in the healthcare profession, you shape the environment and the dynamics of acceptance in your spaces almost more than anybody else. You are almost the primary interface for most people around their healthcare. So recognizing that you are representative of your organization, that people look to you as representatives of that, and being willing to take that power and authority, right, and demand better from your organizations, I think is super critical. and I have to pop out here in like 2 minutes.
Well, I think that actually concludes our presentation today, our panel discussion. For our audience, if you have questions, feel free to type them out on the chat section, especially which panelist the question is for. The email address is futurevoices.dei@gmail.com. We will make sure that those questions get sent out to our panelists, and we will get the answer to you. As a reminder, to help Future Voices plan our next events, we would highly appreciate your feedback and suggestions by completing an online survey. The link is found in the chat box. And I'll leave the floor to Chloe.
And we'd just like to, again, give a huge thanks to our amazing panel. You all have been incredible, and this has been a really powerful discussion. So thank you again to Emily Gam, Dr. S Alexander Kemery, Dr. Joseph Desantis, Sable Schultz, and Ashley Turner.
Thank you again for joining us this afternoon. On behalf of Future Voices, Students for Diversity, Equity, and Inclusion at the College of Nursing, University of Colorado Anschutz, thank you so much for joining us.